Good afternoon, good evening, wherever you might be watching me today. Once again, my name is Nimota. I'm a clinical registered social worker here in Ontario and a psychotherapist. Today's program is about fibroid. Yes, fibroid. So I want all my women and their husband to please watch this presentation today and educate each other on it as well. Like I always do, I'm going to translate it in both English and in Yoruba. So after I explain everything in English, I'm also going to try to explain it to the best of my knowledge in Yoruba. Ẹ kú dédé àsìkò yìí o, gbogbo ẹ̀yin tẹ́ ń wò mí ní ojú òfèrè. Ẹ ṣé gan, mo dúpẹ́ pé tó join mi lénìí fún another presentation nípa fibroid. Kí là ń pè ní fibroid? Báwo ló ṣe ń ṣèyàn? Kí làwọn àpẹẹrẹ tá máa rí? Kí làwọn nǹkan tá lè ṣe? Gbogbo nǹkan bẹ́ẹ̀ la máa discuss ní èní. Mo rántí pé mo ní a máa parí ètò nípa oorun, but someone requested this for some times now. But you know what? Ma squeeze in léni láti make sure pé mo address ọ̀rọ̀ fibroid, especially fún àwa obìnrin. Fún àwa obìnrin náà, àwọn nǹkan tá a máa ṣe bá ṣe lè dúra wa máa ṣàlàyé fún wa ní ẹ̀kúnrẹ́rẹ́. Programming ó lè kọjá 30 minutes, but it's going to be full of information tí mo máa fẹ́ kí ẹ̀yin àti àwọn ọkọ yín náà kan ẹ jọ jókòó kẹjọ kò sí nǹkan tó bad. Like I always say, carry your husband along if something is going right with you. I don't want to say the other side. And you husband as well, carry your wife along if something is not working well in your body. What is fibroid? What is it actually? Ẹ má worry, mo ṣe ń gbọ́rọ̀ onílẹ̀ yẹn bọ̀ after the program, because mo fẹ́ make sure pé mo touch on all the important information fún wa. Then I will do the talk about the land. Àwọn tí àwọn ọ̀rẹ́ Olúwa àti Ọláńṣílẹ̀ tí wọ́n ń tà máa sọ yẹn after the program. But the main purpose of today òun ni fibroid. Kí ni fibroid? What is fibroid? I'm going to use my glasses here to explain some of the notes that I took down that I know that is going to be vital for you as well and me as well as a woman. What is fibroid? Fibroid is a non-cancerous growth. If you're a woman and you are diagnosed with fibroid, it's non-cancerous. It has never turned into cancer. Yes. I don't start feeling, they told me I have fibroid. Hey, maybe that's the end of the day. No, it's not the end of the day for you, because it has never proven to turn into cancer. Alhamdulillah. So it is also called myomas. Myomas. M-Y-O-M-A-S. That's another word for fibroid. Fibroid, they might call it to that person as myomas. So you also have to be aware of other languages that they can attribute to fibroid. Okay, so what is our chances of getting it? Well, first of all, the risk of it of turning into cancer is not possible. It's very, 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 very low. It's not something to get bubuya. Many women, they don't even know they have fibroid. Ọlọ́run kò ṣàánú wa o. Ọlọ́run Elédùmarè ló lè ṣàánú àwọn obìnrin o. Ẹ̀yin women, ẹ̀yin girls, Ọlọ́run nìkan ló lè ṣàánú wa. Ìgbà tí nǹkan bá ń yọ wá lẹ́nu, tá bá mọ̀ pé ó ń yọ wá lẹ́nu, ẹ rí pé nǹkan mi wà ńbẹ̀. When something is bothering us inside us and we don't even know, and we are walking around and we don't know how to express ourselves, like, hey, my stomach is getting big, I don't know what's the reason, maybe I'm pregnant. We don't know. That is why I always encourage all my women, especially if you are in your early age and you notice something that is not appropriate or something changing in your body, please, go to the doctor, go and figure it out, because they'll have instruments that can look inside of you. Excuse me, that they can look inside of you to determine what is actually wrong. Don't do self-diagnose. Don't start going to herbalists for something that you know is not preventable, is not curable. Make sure you find out the actual fact, medical fact, before you start going. I'm not saying the herbalists are not good. Don't take me out of context, but Sometimes it's better you know exactly what is going on inside of you because they do a sonogram. Yes, on my sonogram for most of you that have done it, you know what I'm talking about. Most of you that haven't done it, seek medical advice. But before that, what are the symptoms of fibroid? Diagnose fibroid. The doctor will not tell you what actually causes it. They just say, what I put fibroid there's a fibroid beside your womb, or there's a fibroid in your fallopian tube. They don't really go into extensive details so that you and I will understand it better. Okay, if this is the reason, they just say fibroid, and we all accept it as that without really knowing the depth of it. So I'm going to tell us everything today. So today's program, like I said earlier, it might run out more than 30 minutes, but it's going to be full of information that will help you and I live a better life with this stupid fibroid. I call it stupid because it's not healthy for our body. It does a whole lot of damages to us mentally, physically, and emotionally, especially if you are a woman in your 50s and you have reached your menopause. Let me move forward. I'm shaking my head because this fibroid thing, we can't escape it. We women, we can't escape it. It gave us, we experience heavy menstrual bleeding. You see some women during their period, their menstruation flows very heavy, and it comes with clots, heavy clots. Yes, I have to break it down for us women to really understand. So man law our languages so jẹ́ pé a little bit back on seeing later. Am I worry? Àwọn obìnrin tí mo address, they understand what I'm saying. So every menstruation comes with blood clots. Yes. And it lasts for more than 7 days. Excuse me. If your period lasts for more than 7 days, that's a cause for alarm. Another thing that you might experience is pelvic pain as well. Pelvic pressure or pelvic pain. Fún àwa tí a mọ̀ nǹkan tí à ń pè ní pelvics, I'm going to try my best to describe it so that you will understand your body better. It's under your belly. That's your pelvics. Your pelvic is under your belly. I wanted to show you guys a picture, but I think it might be too graphic for the women and some men too. I like I did this. I don't want to do that. But I'm going to describe it so that you and I will understand it better. Your pelvic is below your waist. It's right there where your pubic areas are. All those areas, because it's like this. It's like a hanger. It's like that. So if I'm opportuned, I'm going to show you the picture. I'm still going to show you anyway. Pardon the graphic. So I'm going to show you so you will know where your pelvic is. Some women will say, my lower abdomen is paining me. Period. When I'm on my period, my lower abdomen always pains me. That is your pelvic area. Yes, that is your pelvic area. So if you are experiencing pressure there during your period time or pain, that is the cause for alarm that you might have some type of fibroid. Another thing is you frequently urinate. You go to the toilet all the time. You pee constantly, all the time. Pay attention to all those things. If you're a woman, and you don't have to be in your 50s, though. Younger women are experiencing fibroid as well. So you don't have, it's not an old age issue like we've known it to be. No, I'm debunking that right now. It's not an old age issue. It's women in their 40s or in their 50s, the one that they get fibroid. No, younger women are prone. Yes, proven fact. I'm going to leave all the links after I'm done with the program. Proven facts. Younger women are also prone, especially children, our daughters, maybe 27, 25, 30. Yes, they can have fibroid. You know, it's not, as long as you are in that middle age of childbearing, you can experience it. Yes, you can be diagnosed with fibroid. You can also have difficulty emptying your bladder. I'm going to explain that to us. You know, sometimes you go to the bathroom and you pee for like a whole long time, you'll be like, that's a cause for alarm as well. Or you feel full, you want to pee, you want to use the toilet, you want to urinate, but you can't. You get to the toilet, you're just straining, you're closing your eyes, you counting 1 to 10. You turn the water on to calm you down. Those are all cause for alarm, for you to go and check yourself out whether you have fibroid. Another thing is constipation. Constipation is when you cannot use the toilet, or when you are using the toilet, your stool is so hard that you are just straining. You're just straining. Yes, it can cause it. If you have fibroid and you don't know it, it could be part of the symptoms that you are experiencing if you have fibroid and you don't know it. Even if you know it, those are all the symptoms that you can go through. So don't, all these symptoms that I've just described, don't look at it as, is it? Is it not it? Take yourself to the doctor. Your doctor will be the best person to give you a proper diagnosis. Don't say, oh, because I have 1 symptom, 2 symptoms, 3 symptoms, maybe I have it. But to confirm whether you have fibroid, go to the doctor. Your gynecologist will be the best person to do your sonogram for you. Another thing is back pain. You see some women, they will have lower back pain. Fibroid. I don't want to say anything to you. Anyway, what I mean by lower back pain is salenyi. Our lower back is salenyi. Oh, mama dunwa. We won't understand why that we are experiencing pain there. Those are all the symptoms that can accompany someone having a fibroid. If you are experiencing fibroid, those are the symptoms that you might go through. Back pain or leg pain. You won't know why your legs is paining you. You won't know why all these pains are just there. Yes, it could be because you have fibroid that is not yet diagnosed for you. Rarely, and I repeat, rarely, is a fibroid can cause acute pain. What do I mean acute pain? Pain yema excruciating mama doing your gone, lower back pain mama tayon. Everything is in excess. It's very rare that fibroid can lead to that level. High severe pain. It's very rare, but it does happen. It can happen. It can occur. That is when the fibroid is probably in the danger zone. I will tell you guys where the danger zones are. Like I said, make sure you see your doctors. If any of these symptoms you're experiencing them, just make sure you see your doctor, and your doctor will be the best person to properly do a proper diagnosis for you, check you inside out. Let's confirm fibroid, and then they will be able to tell you where the fibroid is located. Once of fibroid is outside your fallopian tube or it's inside your fallopian tube, they will tell you. Fallopian tube is where the joint. So I'm going to get to that in a few minutes. What are the causes? What are the causes of fibroid? I'm going to break it. This particular one, I want us to pay very close attention to it. So certain things we don't know as a woman. So I want us to please pay attention. Even possible, take paper and pen as I'm doing this particular video. Go and grab yourself paper and pen, or watch it later and then write everything down as I'm explaining it. It could be a genetic change. What do I mean by genetic change? Sherry, our genes is very unique. Genes is very different. So when something changes I'll give you an example. This is just an example. Say this is a normal gene, and all of a sudden your gene turns this way. It's very abnormal. Now it's not the same. If all the experiment they are doing points to a gene going this way, I'm just using this as an example, and all of a sudden your own particular one shifted a little bit, that's changes in your gene. So that can also lead to fibroid as well. And then another thing is hormone. This is the most important thing because a lot of people don't really know what is hormone. Our hormones are 2 things. They consist of estrogen and progesterone. Yes, we have female has two hormones. We have estrogen and we have progesterone. Those are the two hormones. And what do they do? What are these two things? What are they? What are progesterone and what are estrogen? Well, they stimulate development of the urine lining, our urine, the lining of it. They stimulate it. Period wa flow dada. It helps us to flow normally. But fibroid contain more estrogen. I'm going to tell us what that estrogen is. Fibroid contain more estrogen and progesterone. It has more of it. There's a normal balance. It's out of balance. When it's out of balance, then we end up experiencing fibroid. What is estrogen and how does it affect our body? Well, estrogen affects our reproductive system. Estrogen affects our reproductive system, our urinary tracts, our heart, and blood vessel. What is blood vessel? Only kinito mangbe those are what we call blood vessels. So fibroid estrogen affect all those things. Our bone, whether our bone is strong or weak, estrogen is in charge of all those things. Our muscles, estrogen affect those parts of our body. Our breast, estrogen is part of that as well. Our skin, the way our skin looks, it's thanks to estrogen. We'll give estrogen the kudos for that. It affects all that. It affects our whole health. Estrogen affects our hair as well and our whole body. It also affects our pelvic muscle. Remember the pelvic muscle that I described earlier? What's going on today with my voice? And also our brain. Estrogen is responsible for all these things that I've just mentioned. Yes. So what are the symptoms of low estrogen and high estrogen? Another thing estrogens affect is hot flashes. You see some women, they will when it's hot, they will feel cold. When it's cold, they will feel hot. Hot flashes all of a sudden. You just sweat all of a sudden. And also our mood swing. Those are all what estrogen affects. So, some of you that are having thinning hair, you don't know why your hair is falling out. It's estrogen when it's in different categories. Our nails, those things, estrogen is responsible for all those things as well. So a lot of things we don't know the cause of, and we really don't know what is that estrogen. So, but estrogen also, this estrogen, if you are low, this is a major health risk of low estrogen, which include osteoporosis, which is loss of bone masses. Bone here, it will be there, but it's really hollow. So people that are diagnosed with osteoporosis, they usually have bone loss. And when you have a bone loss, you are prone to falling. Because the bone is not as solid as it's supposed to be. Then another thing you truly experience if you are, experiencing low estrogen is heart disease, which can lead to heart attack. Yes, heart disease can lead to heart attack. What are the symptoms of low estrogen in our body as a woman? Kí làwọn nǹkan tá lè experience tí a bá ní low estrogen lára? we will experience bloating. Ẹ rí pé nínú tá bá fẹ́ ṣe period wa a week or two before, tá bá fẹ́ ṣe period wa ikùn wa máa wúwá, our stomach will be bloated. That is if we're having low estrogen. Another thing is we'll experience swelling and tenderness in our breast. Ẹ rí pé ẹlòmíì ó máa kún ní time tí ó bá ti tó be a week or two before your period, your breast become bigger. You know, my period is about to come, my period is about to come. That is when you have low estrogen. These are all I'm explaining now is the symptoms of low estrogen. I've explained earlier what estrogen is and progesterone. I'm going to explain later. Another thing about low estrogen, if you experience low estrogen, is I don't know what happened there, but Facebook just did something funny. So in case there's a blank a minute there, it wasn't me, it's Facebook. Another thing that you can experience is decreased sex drive. You won't be more active when it's time to have sex. You don't feel like being bothered. That is because you are probably experiencing low estrogen in your body. Another thing is irregular menstrual period. Your period will come this month, it won't come the following month. Or it will skip 2 months and then it will resurface again. Akomaṣe period yẹn ní ségesège ni kò ní wá bó ṣe yẹ kó wá. Tó bá yẹ kó bóyá on the 20 ló yẹ kó wá, ó lè jẹ́ pé on the 1st ló máa wá ní the following month. That is estrogen issue. When you have low estrogen, those are the things that can occur in your body when your estrogens are low. Another thing that you will experience is mood swing. I said that earlier. Mood swing. And then some women will experience headaches. You won't know why. You slept well, everything is okay. Then all of a sudden you start getting unnecessary, unexplainable headache. Another thing is anxiety and panic attack. For some of us that don't know what anxiety is when you are stressing yourself over little things. When you're overstressing yourself over little things and it becomes overwhelming for you. And then another thing is you start gaining weight. Especially we women, it's our abdomen. You start gaining weight in that lower abdomen. Everything, you don't know why your stomach is just getting big. You just start getting, putting on weight all over. And you are eating normal food. You haven't changed your diet, but you're just getting fat for nothing. Estrogen yìí ó lágbára o. Ẹ rí pé a dáràn lórí ọ̀rọ̀ estrogen o. K'Ọlọ́run ṣàánú wa wo obìnrin o. K'Ọlọ́run ṣàánú wa o. But Ọlọ́run tó fi sí wa lára akuku kó wa yọ lágbára Ọlọ́run. It's not our doing. We don't have control over it. Another thing, when you have low estrogen, is kí gbogbo irun já. You have massive hair loss. Ẹ̀rọ àwọn obìnrin mi, they don't have any hair at all in their head. Is because they have low estrogen. Ẹlòmíì tó bá lọ fọrun ẹ̀ nù, tó bá lọ fọrun ẹ̀ báyìí, tó bá ní kó ń fọwọ́ kan orun báyìí, gbogbo orun ti já sí lọ́wọ́. Kó máa ṣe treatment lọ láàárọ̀ títí dalẹ́, it won't work. Some women, they will go and wash their hair and their hair will just fall in their hands. Everything will just come out. Even if they're doing treatments, it won't work. Guess what? It's because you have low estrogen. There's nothing you can do. There's also something you can do, which is the therapy, hormone therapy, but there's always side effect to all those things. So another thing is your hands will be cold, your feet will be cold, trouble sleeping. They cannot sleep at normal time. They just can't sleep. They feel restless. Time to your consum. They will just be tossing and turning in their bed. To sleep, it will be so difficult. Because they didn't sleep properly. That's estrogen, low estrogen in your body. Memory problem to one. Where did I put this thing? I can't remember. You start, forgetting things, become forgetful. I can't remember where I put this. Where did I put it? Where is it? Then you start accusing people of taking your things when you yourself can't remember where you put it. Those are all signs of low estrogen in your body. And I'm going to move forward to progesterone now. Okay, what are the signs of low progesterone? Low progesterone in our body is irregular menstrual cycle, infertility, Low progesterone is, how can I put it? Is the one responsible for our fertility. Estrogen is another thing. Progesterone is another. Progesterone is the one responsible for our fertility. Whether we can get pregnant or we can't get pregnant, that's the responsibility of the progesterone. So if you have low progesterone, it will be so difficult for you to conceive. I hope I'm clear on that. You understand what I'm saying? It'd be so clear to, it'd be so hard to conceive. You see some women, they've been trying and trying and trying. They just can't conceive. That's because they have low progesterone in their system, in their body. So another thing is, like I said earlier, they also experience headache and migraine. Headache and migraine is another symptoms of low progesterone. Mood swing is another thing of low progesterone. Estrogen and progesterone, they basically have similar symptoms. Only one or two things is a bit different. Yes, it's a bit different. Another thing is weight gain, I said earlier. So if you have low progesterone, your symptoms will be so similar to low estrogen as well. So they interlock. But the most important thing that I want us to really understand about progesterone is that it is responsible for our fertility. That is the difference between estrogen and progesterone. The main thing is progesterone is responsible for our fertility. So check yourself out, go to your doctor, seek advice, medical advice if it's difficult for you to conceive, to get pregnant. Maybe you have low progesterone. There's a medication they will always, the doctor will probably prescribe to you to boost your progesterone level. What are the side effects of high progesterone? Mood swing, weight loss, tenderness in the breast. See, I told you, they are interlocking. So imagine if you have low estrogen and low progesterone, you have double jeopardy. We call it a double-edged sword, because you are experiencing the same thing in a double dose. Yes, in a double dose. So you see some people, they just become cranky. All of a sudden, you didn't do anything to them. They will snap at you at any little thing. They cannot control it. Remember, they can't control it because it's their body's natural response. They can't control it. They might have, when they explode, they might now reflect like, why did I explode like that? It's all due to imbalance in the hormone. Water retention, that's another thing. You see some women, they retain water in their body. That is another thing when you have high progesterone. Those are the symptoms of high progesterone. So go to your doctor, check it out, because especially tomorrow, you'll be swollen and they won't understand. The doctor will not explain to them, like, you know what, this is what's going on in your body. Doctors don't have time to be explaining to you at all, because if you are sitting in front of them and they are explaining everything like I'm explaining it now, you know how long it's going to be? They are losing customer. So they are not going to sit there. Doctor will let him have 30 minutes, 40 minutes. They don't have. All they will do is just prescribe you medication. Oh, this is what you have, and without explaining exactly what it is that you are diagnosed with. They will give you the medication, and it's up to you now to figure out what is exactly wrong in your body. That is why I'm explaining everything thoroughly to us now. Watch the video a couple of times so you can get used to your body. Once you are used to your body and you go to your doctor and your doctor say, oh, this is what you have, blah, 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 come back to this video and say, oh, what is progesterone? Oh, this is what progesterone is responsible for. This is what estrogen is responsible for. Please, 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 please take notes of everything I'm saying, and if possible, save this video, because no doctor will explain to you exactly what I am explaining to you now. Another thing, this is very important, and I'm sure majority, and I'm using majority because we are all women. This is a women's topic, but at the same time, if you're a man, share it with your wife. Another thing about low progesterone is we call it vertigo. V-E-R-T-I-G-O, vertigo. Or another word for it is spinning sensation. Spinning sensation. How is it experienced? ẹ̀rẹ́ lomi ó lè máa ṣe nǹkan lọ kó kàn bẹ̀rẹ̀ sí ní kó kàn ní àwòyí ń kọ́ mi ilé ń spin ó dà ń pé ilé yẹn ń spin pé ó dà ń pé the world is spinning. Yes, that is another symptoms of high progesterone. High progesterone. Mo á tún repeat ẹlòmíì lè wà ó kàn lè máa ó lè jẹ́ pé bó ṣe wẹ̀ tán ojú ẹ̀ kan bẹ̀rẹ̀ sí ní máa òyì bẹ̀rẹ̀ sí ní máa kọ́ but òyì tó ń kọ́ yẹn ó máa dà pé the house is moving around. That's why they call it a spinning sensation. Ó máa dà pé the house spinning around like this and it will take like maybe 20-30 minutes. Ẹ wá imagine kò yẹ pé that person lives alone. They will fall and hurt themselves. If you experience that spinning sensation, let everybody around you know what you are going through. High progesterone might be responsible for that, but go to your doctor to get evaluated, to get tested. There's a test they will do for you to know your progesterone and estrogen level, whether it's normal or whether it's abnormal, if it's low or high. You know. Once you know what your body is going through, it will be easy for you to manage yourself. Sherry, that spinning sensation, it just come out of the blues. You wouldn't expect it. And if you're telling people, you know what, the word, it seems like the house is spinning, it's going round and round like a revolving door. Let people know your experience. Let them know. Speak out, scream out, let people know so you can get help. It could be because your progesterone is pretty high. Like I said, I'm going to leave a link afterward so that you can read more on it. You can educate yourself, educate your friend, educate your daughter. What are the risk factors? Kí ni risk factor? Báwo la ṣe lè rí? Báwo ni fibroid yìí gan ṣe máa ń ṣèyàn? Well, it's so unfortunate. It's mainly occurring in black women. Black women, yes. It happens to other races too, but it's more prominent. Very high within the black race. Yes. I don't know what's going on in our gene as a black people, but it's prone to occur in black women. Even in younger women as well. I said it earlier, even in younger women as well, black have fibroids and at younger age. Yes, they have it at a younger age. So if you see a 22, 23 years old diagnosed of fibroid, it's normal. It's not as if it's abnormal. It's not. Yes, it can happen to younger women as well that haven't had any child. It can happen to them. So don't see it as fibroid. Fibroid. All those things that we get so afraid of. Don't be afraid. It's normal. It can happen to younger women at a younger age. Another thing is there's another thing. If the fibroid, they come in small little pieces. Some are there in our body that even the doctor cannot see it. We call it seedling. Seedling. Even the doctor cannot see it with their naked eye. But if they use some kind of instrument, they will be able to see that there's a fibroid here. That is the beginning of it. That's why they say that all women have fibroid. Because it depends on what you do and what age you are. That will be the something that can trigger the growth of it. There's another thing they called, it's very large. When you have large fibroid and it's growing to your rib cage. The fibroid is so huge, it looks like they are 6 months pregnant, 7 months pregnant. That fibroid has expanded to their rib cage. What do I mean? Your rib cage is under your breast. So it will now shape like you are pregnant because it is that big. Some fibroid weigh 20 pounds, some weigh 30 pounds. Yes, it can get that big. So it's like carrying a baby. It's so huge to the point that even the women that are experiencing a very huge fibroid like that, they become very uncomfortable. And it sits on your bladder. If it's that heavy, it sits on your bladder. So that way you will be using the toilet very often. Please, 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 if you notice any changes in your body in that aspect, first thing, go to your doctor. Go to your doctor. I'm always referring you to your doctor. Your doctor will be the best person to give you proper diagnosis of what's actually going on inside of you. What are the other factors that we might experience? Onset of menstruation at an early age. Like some young kids, they start doing their menstruation at 5, 7, 9. Early stage of menstrual period. Period. Maybe later on in life, they might experience fibroid. Who knows? Obesity, when you are extremely heavy weight, you are extremely heavy, try to cut down, do some exercise to lose that weight as well. Another thing that Richards also find out was if you have a vitamin D deficiency, you are also prone to develop fibroid. So load up on vitamin D, especially we women. When we are doing our menopause, we lose a lot of estrogen. We have low estrogens. Please double up on your vitamin D. Take them daily to avoid osteoporosis, so that when you get older, your bone will still be functioning well. You won't be prone to falls, slip and falls, and injure your hip. And then you have to do a hip replacement. Please take your vitamin D on a regular basis, and then have a high diet. Having a high diet and red meat also, cut it off. Those of us that like to eat 10 meats at a time, 20 meats at a time, cut those things off. Meat is not good for our body. Meat is not good for our body at all. So please, let's cut down on that as well. If you drink alcohol, let's try to cut down on that as well. If possible, stop. If you drink beer, those things will trigger the growth of your fibroid. What are the prevention? How can we prevent ourselves from experiencing this fibroid? Well, little scientific evidence is available on prevention. Only little. There's very little evidence that suggests that this thing can be preventable. So it's a lifelong issue. You can remove it and then it will regrow back. It's possible for it to regrow back, especially if in your mid-50s and you are diagnosed with fibroid. Your doctor might not want you to go through the removal process because of your age. They will probably advise you, don't worry, it will shrink. Yes, it will shrink because you don't have your hormone level is decreasing. Remember I said earlier that low progesterone, high progesterone, estrogen, those are hormones. If they start diminishing, it will affect the growth of the fibroid. So if it's not balanced, because there's a certain amount of number the progesterone and the estrogen supposed to be, which is normal. But if it's abnormal, then that's how we end up in this situation that will be experiencing fibroid. So please, stay away from red meat if it's possible. Minimize it if it's possible. Take it out of your meal completely and stay with fish and chicken. Another thing is lifestyle changes as well. Maintain a normal weight. If you are on the heavy side, try to lose some weight. Eat healthy. Whatever you eat is exactly what you become. So if you have any questions, more on it, you can inbox me. I will explain to you after the program. I'm going to leave the link after the program so that we can read more on it if you have time. But at the same time, please, this is a very vital video. Watch it again to understand everything that I've just explained to you. If any of those symptoms apply to you, go to your doctor, seek doctor's advice. Don't self-medicate yourself inside the house, like some people love to do. Apart from that, that will end today's program. But before we go, I said earlier that the Oreoluwa, the land that I was introducing to everyone to get involved into. Well, àwọn Oreoluwa and Olanshile Nigerian Limited. Àwọn náà ní ilẹ̀ náà o. Níbo wá ní ilẹ̀ náà wà? Ilẹ̀ yẹn wà ní Oko Agbon Estate ní Badagry, which is 15 minutes away from Agbara. Báwo la ṣe lè get involved? How can we get involved in this land? Well, there's a promo going on right this minute. Promo yẹn ṣì ń lọ, it has not ended yet. The promo is still ongoing. It has not ended yet. How much is the land? The plot of land is 650,000 naira. Bẹ́ẹ̀ni, a plot of land is 650,000 naira. Cash, the bá san cash. But if you want to do installment plan, tó bá pé installment plan pé san díẹ̀ lẹ fẹ́ ṣe, ìyẹn náà wà, wọ́n gbà wá láyè láti ṣe bẹ́ẹ̀. Èló wà ní tá bá ní ká ṣe ní san díẹ̀. San díẹ̀ is 700,000 naira. Pé kò ṣe nǹkan tó máa ní wá lára láti ṣe. San díẹ̀ yẹn wọ́n wá pín fún wa ní pé okay o, you deposit 350,000 naira first down payment, then after that lóṣooṣù a máa san 100,000 naira ní oṣooṣù. Ṣé rí pé wọ́n fi ní wá lára rárá. Tẹ́ bá tún wá ní okay o, mo fẹ́ bínú tán, mo fẹ́ ra 1 acre, which mo mọ̀ pé gbogbo wa tá à ń wò mí lórí ètò yìí olówó ni gbogbo wa, orí olówó la gbé wá sílé ayé, so ti di dandan ká ṣe kí ni ká bá wọn nípìn ní orí ọ̀rọ̀ ilẹ̀ yìí. Pé 1 acre la fẹ́, 1 acre wọn is 3.5 million. Bẹ́ẹ̀ ni tẹ́ bá san owó tán ní kìṣì pé mo fẹ́ díjú tán jẹ́ kí n ra ilẹ̀ yìí, kí n ra pamọ́. 1 acre is 3.5 million. Wọ́n tún gbà wá láyè o pé ká san ní díẹ̀díẹ̀. Àwọn Oreoluwa àti Olanshile wọ́n dára gan. Wọ́n gbà wá láyè pé ká san díẹ̀díẹ̀. Tẹ́ bá fẹ́ san ní díẹ̀díẹ̀ ní oní 3.5 million fún 1 acres yẹn, ẹ máa kọ́kọ́ san 1.5 million down payment. Ìyẹn lẹ máa kọ́kọ́ kó sílẹ̀. Tẹ́ bá ti kó 1.5 million sílẹ̀, ẹ wá máa wá san 500,000 naira ní oṣooṣù. Bẹ́ẹ̀ ni wọ́n fi ní wá lára. Wọ́n fẹ́ kí gbogbo wa náà ká nípìnlẹ̀. Ṣé mo rántí pé mo sọ pé phase 1 wọ́n ti tà yẹn kọjá. Phase 2 ló ń tà lọ lọ́wọ́ ń sìn. Mi ní àwọn ọ̀rẹ́ mi tó súnmọ́ mi náà, àwọn náà ní nínú ẹ̀ ní Canada. Tẹ́ bá fẹ́ ra 1 acre, 1 acre yẹn ló pè láti ra, but tẹ́ bá lágbára 1 acre, ẹ ra 1 plot náà. Àwọn question tó wá ń béèrè lọ́wọ́ mi, táwọn èèyàn ń béèrè lọ́wọ́ mi, òun mo fẹ́ kí gbogbo wa mọ̀ pé tá bá ti rà, tá bá rà pamọ́, pé ká bù pamọ́ síbì kan fún ọdún 5, ṣé wọ́n ní gbalẹ̀ lọ́wọ́ wa? Kò sí nǹkan tó jọ bẹ́ẹ̀ o. Bẹ́ẹ̀ ni kò sí nǹkan tó jọ bẹ́ẹ̀. The only thing tó gbà wá nímọ̀ràn ni pé ńkọ́ pé tá bá ra kó pọ̀ bẹ́yẹn, bó jẹ́ ẹyọkan lára, tá bá rà ká ṣe 4 corners sí, ká ṣe fẹ́ǹsì sí síbẹ̀. Tá bá dẹ̀ ṣe fẹ́ǹsì síbẹ̀, àwọn máa charge wa ní 10,000 naira ní oṣooṣù, 10,000 naira ní ọdọọdún rádà, láti lè bá wa máa ṣánko bẹ̀. Tá bá rà pa fẹ́ bò pamọ́ fún 1 plot, wọ́n charge wa ní 10,000 naira ní ọdún for maintenance fee. Ìyẹn fáwọn tá àti ready láti kọ́ ilé sí, tá fẹ́ bò pamọ́, àwọn máa san 10,000 naira ní ọdọọdún. Fún àwọn tá bá ra 1 acre, 50,000 naira ni wọ́n máa gbà ní ọwọ́ wa fún owó maintenance fee. But ẹ máa ní láti ṣe fence 4 corner yín sí orí ilẹ̀ yẹn, so that ẹ lè mọ̀ pé òkè tí yín lélẹ́yìn wọn tí wọ́n bá ti yọ fún yín, ẹ wá ṣe 4 corner sí. Dandan kọ́ ni pé kí 4 corner yẹn kó ga, at least kẹ́ fi ṣe àmì sí orí ilẹ̀ yín, so wọ́n máa bá yín maintain ibẹ̀ tó ráwọn èèyàn wà mẹ́tọ̀ ń ṣọ́ ibẹ̀. So kì í ṣe ilẹ̀ tó jẹ́ pé ọmọ onílẹ̀ kan tún máa jágbà lọ́wọ́ yín. Òun ni ẹ ṣe ń sanwó maintenance fee. Tẹ́ bá ti ń sanwó maintenance fee, àwọn èèyàn wà mẹ́tọ̀ máa bá yín ṣánko, tó máa bá yín clean ẹ̀. So ẹ ti mọ̀ pé definitely kì í ṣe ilẹ̀ tí ó jẹ́ pé mo rà pamọ́, mo wà lọ́bẹ̀ lọ́dún 5, wọ́n á ná mo nílẹ̀ kan ti gbà. Àwọn family no, kò sí nǹkan kan tó jọ bẹ́ẹ̀. So ẹ jọ tá bá tún ní ìbéèrè sí, get involved pẹ̀lú message mi ní inbox mi, or kẹ́ message mi lórí WhatsApp +1 647 904. Mo ti fẹ́ máa lọ fún yín ní personal number mi o. +1 647 904 8571. +1 647 904 8571. Màá fi nọ́mbà yẹn sí orí ètò fún wa. Or ẹ lè inbox mi ní orí Facebook lórí ọ̀rọ̀ ilẹ̀ yìí náà. Tó bá lè yẹ pé lórí ọ̀rọ̀ fibroid yìí náà lè fẹ́ bá mi sọ, ẹ kàn sí mi ní orí inbox, okay, message mi ní orí WhatsApp yẹn náà. So kò jẹ́ bó ṣe jẹ́ o, ẹ bá wa nípìn nínú ọ̀rọ̀ ilẹ̀ yìí o ẹ dẹ̀ jẹ́ ká share fídíò yìí, ẹ jẹ́ ká share fídíò yìí fún àwọn ìyá wa àwọn ọmọ wa kan wò ó. Ilé fídíò yìí ni ò kì í ṣe pé bóyá àgbàlagbà nìkan ló wà fún, ó wà fún àwọn ọmọdé náà tí wọ́n ti ń ṣe àwọn adélébọ̀ tó yẹ ti ń bímọ. So ẹ share fídíò yìí, ẹ jọ̀ọ́ ẹ bá mi share, ṣe ti gbọ́. Ẹ̀yin olólùfẹ́ mi, ẹ mọ̀ pé mo nífẹ̀ẹ́ yín, ẹ̀yin náà mọ̀ pé torí yín mo ṣe máa ń jáde. Mi ò lọ́bi iṣẹ́ léèní àtọ̀la, èmi àti yín àjọ máa lẹ̀ tìkẹ̀tìkẹ̀ ní orí Facebook ni. Then ẹ̀yin ta tó máa jọ ń ṣe Zoom náà, ẹ má worry, gbogbo yín pátápátá a máa resume kíní Zoom wa padà fáwọn àtàjọ ń join fún support group ní orí Zoom. A máa resume yẹn náà padà ní agbára Ọlọ́run ní ọ̀la. Màá jẹ́ kí gbogbo wa mọ nǹkan tí a máa ṣe lọ́la yẹn fáwọn tí à ń ṣe Zoom, torí àwọn èèyàn kan náà wà tó yìí a máa ń ṣe Zoom counseling pẹ̀lú ra wa, which Ọlọ́run dẹ̀ ń gbà fún gbogbo wa ń bẹ̀. Ẹ ṣé gan o ẹ̀yin olólùfẹ́ mi, thank you so much. In fact, inú mi máa ń dùn tí bá ti fẹ́ wá bá gbogbo wa sọ̀rọ̀ ní pé àwọn tèmi wọ́n ti ń dúró dè mí, wọ́n á ti máa expect mi. Gbogbo ẹ̀yin tẹ́ bá máa wo fídíò mi létí, ẹ jọ̀ọ́ ẹ share ẹ jọ̀ọ́ nítorí Ọlọ́run Elédùmarè kò ní ba inú ilé wa jẹ́. Ayọ̀ àti gbogbo nǹkan tá bá fẹ́ pátápátá Ọlọ́run á fi lé wa ní ọwọ́ ní ìrọ̀rùn. Thank you so much. God bless you. God bless your home. God bless your children. God bless your family. Once again, you take care of yourself and your loved one. Ẹ tọ́jú ara yín, kẹ́ tọ́jú àwọn tó súnmọ́ yín, ẹ tọ́jú àwọn olólùfẹ́ yín, ẹ tọ́jú ara yín, ẹ̀yin gbẹ́ tọ́jú ara yín fúnra ara yín, ẹ tọ́jú àwọn tó súnmọ́ yín. Once again, it's me again. My name is Nimota Raji. I'm a clinical and registered social worker here in Ontario and a psychotherapist. Until we meet again, Nimota cares.